When we think about the phrase body movements, our minds immediately thinks about running, lifting, and stretching, but the word movement is far more deeper and complicated than we know. Today, I'm going to discuss and we're going to deep dive about the terms of movement terminology that professionals use to describe exactly how our bodies move. We'll not only define the terms, but we're going to demonstrate it for us to easily understand the context and the topic of movement terminologies. So let's go and discuss about the movement terminologies. So let's discuss the movement terminologies in Lesson 2, Introduction to Anatomy. And let's begin. Gliding movement. Gliding movement is the two opposing surfaces slide past one another. Here are the examples of gliding movement, which is wrist, capital, and ankle, tarsal. In angular movement, we have three kinds: flexion and tension, abduction and adduction, and circumduction. Flexion and extension. Flexion is movement in the anterior, posterior plane that decreases the angle between articulating bones. Extension occurs in the same plane, but it increases the angle between articulating bones. I demonstrate the examples of flexion and extension here, which are the shoulder, arm, and neck. Abduction and adduction. Abduction is movement away from the longitudinal axis of the body in the frontal plane. For example, swinging the upper limb to the side is abduction of the limb. Moving it back to the anatomical position is adduction. Adduction of the wrist moves the heel of the hand and fingers towards the body, whereas abduction moves them farther away. I demonstrate the examples of abduction and adduction here by showing the arm movement and thigh movement. Circumduction. Recall the special type of angular movement, circumduction, from our model. Hereby, I showcase the examples of circumduction, which are arms and wrist movements. Here are the special movements which I'm going to explain and demonstrate in the next slides. Inversion and eversion. Inversion is a twisting movement of the foot that turns the sole inward, elevating the medial edge of the sole. The opposite movement is called eversion. Here I demonstrate the examples of inversion and eversion, which I showcase in the both movements of my ankle. Dorsiflexion is a flexion at the ankle joint and elevation of the sole, as when you dig in your heel. Plantar flexion is the opposite movement, extends the ankle joint and elevates the heel, as when you stand on tiptoe. Here are the examples of inversion and eversion. Opposition enables you to grasp and hold objects between your thumb and palm. Reposition is the movement that returns the thumb and fingers from opposition. The examples of opposition and reposition are thumb and finger movements. Protraction and retraction. Protraction is moving a body part anteriorly in the horizontal plane, while retraction is the reverse movement. Here are the examples of protraction and retraction by demonstrating the movement of jaw and shoulder. Elevation and depression takes place when a structure moves in a superior or an inferior direction, respectively. You depress your mandible when you open your mouth, and you elevate your mandible as you close your mouth. I showcase the other examples of elevation and depression by showing the movements of eyebrows and shoulders. Lateral flexion occurs when your vertebral column bends to the side. This movement is most pronounced in the cervical and thoracic regions. As well, I chose the example of lateral flexion by showing the movements of my neck and spine. Thank you very much for observing my presentation, and even though it has flaws, I appreciate that you still observe it. In this section is the acknowledgement section, which I provide my name, section, and my professor in this subject.